Good morning, everyone. I'm Patricia Bainer. Uh, Today, I am going to discuss the fourth topic of nursing theories and models. That is application of nursing models, part 2. So these are the objectives. By the end of the topic, you should be able to discuss theories related to nursing, discuss the basic foundation of each theory, and apply each theory to nursing practice. Here, basically, I am going to discuss three theories. Those three theories are Dorothy Orem's self-care deficit theory, Betty Newman's system model, and Bainer's philosophy of nursing practice. First, I would like to discuss about Orem's self-care deficit theory. Actually, this theory is a combination of three theories called as theory of self-care, theory of self-care deficit, and theory of nursing systems. All these three theories are presented by Dorothy Orem, and self-care is about the human regulatory functions that a person must carry out for himself in order to maintain his life, like washing the body, eating, bathing, and so on. According to Orem's, nursing is needed when a person is unable to provide care for him or herself. Um, so, this theory of self-care says that actually it's about the regulatory processes, as I mentioned earlier: washing the body, eating, bathing, grooming, like that. So or if there is a person, that person needs to learn about most of the activities in daily living that he or she must perform for the maintenance of good health. So this theory of self-care is basically about performing uh, self-care or daily activities in order to maintain good health. So the second theory is theory of self-care deficit, or theory of dependent care deficit. According to this theory, um, when a person may not be able to perform daily living functions, and the deficit requires assistance from other parties or healthcare personnel. So, deficit is the incapability of individuals to practice the functions which serve their basic needs. So, when the patient cannot perform these activities, there will be a deficit. So then the third theory comes into play. So according to the third theory, that is theory of nursing systems, uh, it described nurses' role in order to facilitate or assist the patients to maintain self-care. So this theory indicates the actions nurses take in order to facilitate or assist the patients. Also, this is about the actions and the sequences of actions to be performed with purpose in regard to the nursing system. So, when there is a self-care deficit, nurse has to assist the patient to maintain their self-care. So this nursing care we can divide as we can divide into three types as wholly compensatory care, partly compensatory care, and supportive educative care. Wholly compensatory care means you provide all the necessary care instead of the patient. Uh, for example, if we take unconscious bedridden patient, as a nurse you have to provide all the care for that patient. So wholly compensatory care means you do all the things for the patient. Partly compensatory care means you assist only for the necessary functions as a nurse. Um, for example, if there is a person who has a fracture in his leg, so for what type of things you have to assist, you need to assist for the patient to go to the bathroom, and like that. For some activities, only for some activities you have to assist. So it is called partly compensatory care. In supportive educative care, you don't do anything for the patient, but you educate the person to promote their activities of daily living or to maintain their self-care. So here we mainly focus on educative role. So it is called supportive educative care. So then according to the ORMS, nursing process can be divided into three steps. So the first step is the data collection about the patient and make the judgments about the patient. That means you have to make diagnosis about the patient. Then the second step is designing and planning nursing interventions based on the data you gathered in the first step. Then final step is the evaluation of patient's progress and continue to review the plan. Okay, we discussed about ORM's self-care deficit theory. Now I am going to discuss about Newman's system model in nursing practice. So according to the Betty Newman, patients are seen as living in an open system. So patients are seen as open systems, and they are open to the environment and they interact with the environment. So according to her, the function of a nurse is to promote client wellness by stressing on prevention and reducing the risk factors for diseases. So according to Newman, she viewed the patient as an open system, and she told that the system is composed of 5 variables. Those 5 variables are physiological variables, psychological variables, socio-cultural variables, spiritual variables, and developmental variables. So physiological variables consist of bodily structure and functions. Psychological variables focused on mental processes and relationships. Socio-cultural variables are composed of social and cultural functions, and spiritual variables is basically about spiritual beliefs, and the final variable, the developmental variable, consists of life developmental processes. So Newman told that the human system is composed of these 5 variables, and there are this system is interact with the environment, and this environment consists of 3 types of stressors. So these 3 types of stressors are internal environment, external environment, and created environment. So for internal environment include all forces contained within client system, for example autoimmune response, degree of mobility, attitudes, values, expectations, and behaviors. So external environment are the forces outside the client system, like relationship with family members, friends, education, and finances. So created environment is the environment created by client uh, in order to maintain a safe environment. So according to Newman, so the humans are interacting with these environmental stresses, and so Newman designed her nursing process, uh, and nursing process. She categorized nursing role into 3 categories. First category is nursing diagnosis. So in there you have to make a judgment about the patient's problems through the collection of data. And then the next category is nursing goals. So you have to make proper goals according to their problems with the discussion with the client. So then third category is nursing outcomes. So these outcomes are determined in relation to the 5 variables and achieved through primary, secondary, and tertiary intervention. So uh, so according to Newman, the nurse's role is to prevent the previously mentioned stressors from entering into the human system. For though to prevent those stressors, there are flexible line of defense and normal line of defense within this within the environment. If those previously mentioned stressors can invade these lines, the person will get diseases. So up to now we discussed about RM self-care deficit theory and Betty Newman's systems model. Now I am going to discuss Bainer's philosophy in nursing practice. So Dr. Patricia Bainer is the first nurse theorist to have proposed the stages in competency level among nurses. So this theory is the is a theory of skill acquisition. Um, so, according to her, nursing students need to pass through 5 distinct stages in learning from novice to expert. So, these stages of clinical competence include 5 stages as I mentioned earlier. So, these stages are novice, advanced beginner, competent, proficient, and expert. In novice, novice is a person who has no nursing experience or handle any particular nursing situation. So you can take a nursing student, um, first year nursing student as a novice. So then advanced beginner. So, advanced beginner is a nurse who might be familiar with or have had some experience of nursing practice but still need some guidance for decision making. So, for example, you can take the nurses who enter to the profession, and that means um, after the student period, uh, the nurses who enter to the profession, we can take as advanced beginners. So then competent nurse. So these nurses have 2-3 years of experience in the field, and so they have the mastery of almost all the procedures and can organize their work. So then we move on to the next stage, that's the proficient stage. So these uh, in compared to the competent nurses, these proficient nurses decision making is faster than the competent nurses. So they can see situations as whole and not as parts. They can make good decisions regarding various situations. Uh, then the final stage, that is the expert stage. So these nurses no longer rely on an analytical guidelines or rules in making decisions. So by their experience they can make sudden but correct decisions. So their focus will be on the most relevant problems rather than less relevant ones. For example, you can take a nurse with 5-6 years of experience in intensive care unit. You can take as a expert nurse. So Bainer told that we can use 7 domains to determine this expertise. So these domains are the helping role, the teaching coaching function, the diagnostic and patient monitoring sorry, the diagnostic and patient monitoring function, effective management of rapidly changing situations, administering and monitoring therapeutic interventions and regimes, monitoring and ensuring the quality of healthcare practices, and finally the organizational and work role competencies. According to Bainer, so we can use these criteria to measure the expertise of the nurses. Okay, so basically here in this lesson we discussed about 3 theories. Those are Orem's self-care deficit theory, Betty Newman's systems model, and Benner's philosophy of nursing. So I would like to summarize the lesson. First, we talked about Orem's self-care deficit theory. So according to Orem's, nursing assistant is needed when the person is unable to provide care for him or herself in the situations of personal health. So actually the Orem's theory is the combination of the theories, namely theory of self-care deficit, and theory of nursing systems. So then we discussed about Betty Newman's theory, that is called systems model. So according to Newman's, this theory is classified as a system model, as I told earlier also. And patients are seen as an open system that are interaction with each other. And then finally we discuss about Bainer's theory. The Bainer is the first nurse theorist who developed the theory of the stages in competency level among nurses. So there are 5 stages according to Bainer. So those are novice, advanced, beginner, competent, proficient, and the expert. So if you have any questions, you can direct those questions to me or any other academic in our department via mobile phones or mails. So you can solve your doubts.